And the new generic Guaifenesin tablets, is there a short-acting component? Meaning that they're just like Mucinex, or do you think they're the same as the old Perrigo? So, I had a stash of the old Perrigo, and I'm slowly going through that stash, and I am converting personally over to the new generic Mucinex. It's different from the Perrigo and me anyway. I feel more of the rush of action, so I think there is more short-acting in it. I think it is more, I think it's truly generic Mucinex. But time will tell on that one. And what do I think about Guaiac? If it works, it's great. And Dr. St. Amand and I are worried because it hasn't worked in the past, but it may be a new formulation. And you guys are the vanguard. You are testing it, and we'll see what happens. It'd be wonderful if it works because it is so inexpensive. And I have one patient who came to me a couple months ago, and money was a real problem for her, so she had started the Guaiac, she was taking it in the morning, and she was taking the Guaifenesin capsules from the Fibromyalgia in the evening. And so I said, hey, how would you feel about going on Guaiac, 100%, I really want to know. And she said yes, and I told her how much to take, and I told her I would map her for free the next visit, because I think it's important for Dr. St. Amand and I to know. But for us, until we know, for the new patients we see, we have to recommend the tried and true, the Fibromyalgia Guaifenesin capsules. The problem with the new Mucinex is, since I find it packs a bigger punch, it would be harder for new patients to use because it would make them feel even more crummy than other things. So I'm giving it as an option to people who have been on Guaiac for a while, that are on higher doses. And also, for some people, they really have a hard time taking a medicine every 8 hours. For whatever reason. I have one person, she is a wildlife biologist, she's in the field. It's really hard for her to have the Guaifenesin and water with her every day when she's out in the field. So there are lots of different reasons, and that's why the generic Mucinex is a nice option if it can work for people. But again, Vicki can work with you and Annette too about different types of Guaifenesin, what would be best for you, and Vicki can see if it's working.